A midwife is a trained health professional who helps women during labor, delivery, and after the birth of their babies. Women who choose midwives usually want very little medical intervention during their delivery process. The healthcare system built around this belief, want, and need is the midwifery model of care. The belief that pregnancy and birth are normal physiological events is at the core of the midwifery model of care. The midwifery and medical models of care for pregnant women are based on specific perspectives on pregnancy and birth. There are important differences between these two models, including differences in philosophy, focus, and in the relationship between the care provider and the pregnant women. The midwifery model of care includes monitoring the physical, psychological, and social well-being of the mother throughout the childbearing cycle, providing the mother with individualized education, counselling, and prenatal care, continuous hands-on assistance during labor and delivery, and postpartum support, minimizing technological interventions, and identifying and referring women who require extra attention. Today we have with us Dr. Vijaya Krishnan. She's a certified professional midwife and is the co-founder of the Sanctum Natural Birthing Center. She's a graduate of the midwifery program from National College of Midwifery and also has a clinical doctorate in physical therapy with specialization in women's education. Hello, Dr. Vijaya Krishnan. It's so nice to have you on Amra Circle. Welcome.
Thank you. Very nice to be here today.
I'd love to pick your brain on so many different issues today. So let's start with the midwifery model of care and jump right in. Could you shed some light on the midwifery model of care and especially the midwifery model of care in India?
Certainly. So I think the thing that people have to understand is the midwifery model of care has been around for as long as humanity has been alive. Someone caught the first person's baby and that woman or person became the midwife. So the idea of it's not something of a rocket science. It is not something that has just, been. It's sort of feeling like it has been revived back, but midwifery has always been a part of the social fabric of our lives. If we think of birth as a biological process, we get up, we brush our teeth, we have our digestive functions, we breathe. So is birth, right? So when pregnancy and labor and birth are an intrinsic part of our biological part of the life. So what is the midwifery model of care? Midwife means with woman. When you look at with woman, it is a woman-centric model of care. It is a birthing person-centric model of care. The birthing person is at the center of the entire model, which means that everything we do is done with the ability for the mother to understand what is happening in the entire antenatal period, in labor and birth, in postpartum, breastfeeding. It's a very, very supportive model of care. When it comes to in India, the thing that I want to point out is that dais have been part of the system for the longest time. Now, what is the difference between the dai who used to work in the community and the local hospital and the scientific midwifery model of care that say happens at the Sanctum is that we have the medical background and the medical infrastructure and the medical knowledge in order to keep the woman safe. Most dais also kept the women safe. It's not that they did not. So when you look at that aspect and you say, what was the biggest advantage in that system? They were in the community. They were a part of the community. They knew the woman. They knew her family, and there was nothing. Nobody came to her in one of the most private moments of her life. A stranger was not there with her, right? And so the scientific midwifery model of care that we use utilizes the same hands-on heart wisdom. So we always talk about heart and hands as being a part of midwifery, the same hands-down heart system, and we use the medical model along with that, not the medical model, the medical knowledge along with that, in order to keep the woman safe as well as self-reliant when it comes to understanding about her body, understanding about her labor, and having the support systems around her in order to give birth to her child. This is the big difference which I want people to understand. When we talk about the typical delivery, we talk about delivery. Somebody is delivering the woman of a child. In the midwifery model of care, the language is birth. The woman is giving birth to her child. As far as India is concerned, I think this scientific midwifery model has completely not been exposed to the public at large. The idea was the nurses were trained, given some training in maybe like a 6 months or maybe like an year in the nursing schools, but that is, they were trained to assist maternity care in the obstetric model, which means they become obstetric nurses, whereas the midwifery model of care is midwifery itself is an independent, autonomous profession which has the knowledge, the education, the skills to take care of. So basically, a midwife, a certified, a licensed midwife is the doctor for natural birth. So that's what people have to understand. This is a completely independent profession by itself, and in India it's really as an autonomous profession right now. It doesn't exist. We are trying to bring it back. We have been trying to bring it back for the last 15 years plus. There is only about 2 birth centers in India right now, which itself tells you the story. We are a 1.3 billion population and we are no way going to be able to reach that. Government is trying to do a few things, but again there is lots of resistance at lots of levels, and hopefully we will be able to bring back the model in a way where the normal, healthy, low-risk woman for a pregnancy sees the midwife first and then only a doctor if she needs for emergencies.
Interesting. And that's actually a great overview to the midwifery model. And you brought up medical model of care, and I'd love to understand the difference between the midwifery model of care and the typical medical model of care.
So the easiest answer to that is that the midwifery model of care looks at pregnancy as an inherent biological process and takes care of any problems or any risks that might occur in the pregnancy if and when they happen. The medical model of care inherently looks at pregnancy and childbirth as a risk, and then tries to figure out where to put which box to fit this woman into, and then looks at if everything goes well, then you might have a natural birth, or then, oh great, you had a good birth experience. But so this is 2 completely opposing worldviews, whereas the midwifery model of care believes that for the average healthy low risk woman, what she needs is good understanding of her own body, good education about what is to be expected, which, you know, in the typical older generation, say 50 years ago, it all happened organically. If you ask your grandmom or your great grandmom, she would say, well, what is there? Okay, pregnant was, how many times she would become pregnant? 7, 8, 10 times. And she would say, well, pain will come, baby will come, finished. It was a very simplistic process for them, right? Whereas the current generation of women, she has Google, she has, YouTube, she has so many things that she can search into. Plus, she's constantly bombarded with information but does not need how to make it relevant for her, right? And then the last part is the fear that has been generated with childbirth. For the average woman, when you look at her and you ask her the question, for example, what is the first image that comes into your mind about labor? Pat comes the answer, pain. Or for the average, dad who sits across me, I ask, what is your image? Oh, somebody bringing out a baby to me. But because he is thinking he's going to be outside the room. And somebody brings a baby out to him. But birth is essentially a process that happens for the woman, of her body, by her body, for her body, to bring her baby out. And we get to hold space for her and help her bloom into her birth and make sure that she utilizes every ounce of God or goddess given energy to her and come out of it on the other side saying, I did it, not my doctor did it. That's the biggest difference, right?
Oh, that's very interesting. So the midwifery model of care is slightly different from the collaborative model of care, right? So collaborative model of care is almost the middle ground between the medical model of care and the midwifery model of care. So let's double click on that a little and let's try and understand what Sanctum does and how collaborative model of care is at the center of what Sanctum does.
Pregnancy gives you 9 months not only to grow a baby but to grow yourself as parents. So the decisions that you make and the individualized responsibility that you take is going to impact how you parent your child. So we talk about all this, and one of the problems in the medical system is you don't have time. Essentially, doctors are not bad people. They just don't have time to talk about all of this and parse out, what's going on. A woman's feeling sad. Why don't we take pregnancy and childbirth are emotional, physical, physical, psychological, sexual. There is just so much going on in her body at that moment. And when we just make it a physical event, like a uterus as this vessel carrying a baby, we are completely negating the existence of this woman who is the core of all these processes. So that's where we believe that participation and taking ownership is the first key. But then we also believe very strongly that should that same normal, healthy, low risk woman need additional support, because 5% of sometimes even in some populations we're talking of 10%. Let's say 10% as an average. 10% of normal, healthy, low-risk women might still need some other medical intervention. For example, if you get diabetes, or if you develop hypertension, or for that matter, everything is going well, but in labor and birth you're not unable to, the baby is not able to descend beyond a certain point, or there is some distress. We should not at that point say, well, we tried so far, but now we are going to move you elsewhere. So what Sanctum practices is absolutely autonomous, independent midwifery model of care, and taking the best of that model, but then also having the emergency infrastructure on site. So we are a level 3 hospital. We do have an operating theatre, a level 1 NICU. We do have, all the specialists available. We have OBGYNs on the site. We have a pediatric neonatologist on the site. We have additional consultants who come in as needed, whether it's physicians, anesthetists, all of those things. So the safety net is still there. So that's the collaborative model, which probably the way we have structured it, that it is an autonomous midwife-led birth center, but with all the emergency infrastructure available, is probably available only about 5 or 6 places across the world. And that to me feels the right thing to do, because the woman, ultimately it is not about one profession against another, and none of us is going to take away from each other. We are only going to build into it to meet the woman where she needs and what kind of care she needs.
That actually makes a lot of sense, because I think most people are inherently risk averse. They do not want to take unnecessary risks, and when it comes to pregnancy, certainly not, right? So they would rather err on the side of caution than anything else. So when you're asking them to take such big decisions and choose between a doctor or the medical model of care or the midwifery model of care, it gets slightly tricky. So to me, that's why the collaborative model of care is so interesting.
And it works because I think at the moment when some decision has to be made, that's not the time a woman wants to go somewhere else and see a stranger. It's the same team, the same people, the same known people providing you all the support. And the more important part is, whatever the intervention is needed, when it happens, even if it's a cesarean section, we want the woman to have the same support postpartum as well. So to me, I feel it's very important for parents to understand that the model works because we follow the same evidence-based healthy birth practices, whether it's a vaginal birth or an abdominal birth. We don't need to separate the mother and baby simply because it was a cesarean section. The baby can still come onto the mother. You can still have a gentle cesarean section. You can have minimal separation of mother and baby. Baby can still breastfeed within the first hour. The father can still be there present at the birth. So as long as we are able to follow all those evidence-based practices and ensure that the family comes together as a unit in one of the most spiritual journeys of their life, I think there is something right about this model of care.
Interesting. And when a mother is pregnant, she has to take all of these decisions with her family support, with the spouse's involvement or without. There are all of these different decisions that she has to take, and I think how she chooses to birth the baby is one of the biggest decisions, and she has to take that call sooner than later, right? So how do you know if this midwifery model or the collaborative model is for someone? So if I'm trying to choose, how do I know if it's for me?
So I think the simplistic way of looking at it is, one, you should want to have a good natural birth. So if you are at the point where you feel terrifically afraid, or there is something inside you saying, no, I only want somebody else to tell me what to do, I don't feel like I need to have all the information, I just want to go and give birth and I want somebody to lead me through pregnancy, then this model is probably not for you. But if you, like most of us, for anything, we can look at it. If you go to buy a top of the line Mercedes Benz, right? You go there and the salesperson pitches you that this has that, that is open moon roof, sunroof, blah blah, whatever. And at the end you say, I would like to drive the car once before I purchase it. And the salesperson says, I have driven it 35,000 times in the last year. I've shown it to people. Please, you don't need it. You can trust me. And you're supposed to buy that. Usually most of us won't. We would want to do a test drive to make sure that we understand what it is. So I think for the vast majority of people, as long as you have that intention that you want to birth naturally, you want to have information about what is going on in your body, and you want to make it personalized to you, because like I said, YouTube and all of these will give you so much information. Digital age is a part of where we are at today. If I want to Google something about my health, I am going to. But to make it make sense out of it, to make sure that I understand everything about it, I would want a healthcare professional that I trust and who has the time to give me. I think that's where I would really feel like somebody who would want to choose the midwifery model of care if they want time. They want space to express themselves. They want somebody patient, understanding where they are at. They want all their questions answered, and they want to take ownership of their, and there is risk and responsibility are two sides of the coin. Pain and pleasure are two sides of the coin. There is pain in labor, but there is also so much pleasure, right? So if you want to understand all that and come into your own and say that I am going to give birth to my baby, and by making these decisions, I am okay to take on the responsibility, and I will involve my family, but it's not the family that is giving birth. In India, we have a huge family system that can be a boon, that can be a bane. Weddings are for the whole family. Childbirth is for the whole family. But when you look at the inherent process of who is giving birth, if your mom or mom-in-law are forcing you to have a cesarean section, it is a major abdominal surgery. If the partner or the husband has a kidney stone and everybody said, take out your kidney, people would laugh. But when you have the most minor discomfort, or if the medical professional says, oh, it's only 1 hour after the bag is broken, you might have a risk, and you go ahead and you decide you want to take the baby out. And the mom is drugged, she is separated, she is recovering in the ICU, and everybody else is rejoicing with the baby, saying that, oh, we have a grandchild. I'm not saying that families should not come together to celebrate a birth, but there is something very wrong when the woman cannot enjoy her own birth. So I would really submit that a person who really wants to make the pregnancy and childbirth experience as not only a safe but also a personally satisfying event, that's who should be seeking out the midwifery model of care.
Interesting. That actually brings me to the role of a spouse. So how do spouses step in, and how do they stay involved throughout this journey?
So when you talk about what is the partner involvement, they are just not a driver bringing in the mother in for that appointment. And in most hospitals, many of them will be told to sit outside. When COVID, it became even worse because they were not allowed in for scans, they were not allowed in for any of the appointments. The woman would come out, right? And our part is, I will ask them, do you want to record your baby's heartbeat? When the time comes, like 24, 28 weeks, when we can feel where the baby's head is and spine is, I'll tell them, do you want to feel the baby? Because the mom feels everything from inside. For the dad, it's like looking from outside. Some of them are very tentative to touch. They're like, oh my God, am I going to harm the baby or harm the mom, and when they realize they can touch and feel, you should see the smile on their faces. It's also a very family-centric event. If there are older kids, we ask the older kids, would you like to feel the baby? Would you like to hear the baby? And there's just so much joy. A baby can hear the partner's voice and identify the dad's voice and the mom's voice from starting around 28 weeks. So when the dad says hello baby at birth, that baby will turn. It's amazingly super cool. So for them to understand through the Lamaze classes how they can be a good birth partner, what are things they can do to help the mom in early labor at home, how they need to be emotionally invested, not just physically present with a cell phone.
That is an incredible overview of the midwifery model of care and what you believe in. Thank you so much for that. It was really nice having you on Amra Circle.
Thank you so much.
Amra is focused on early childcare and education, providing infants and toddlers with individualized play opportunities and parents with access to an array of expert resources. Amra ensures families have the best start in life by providing the right environment and experiences for children that are crucial for early years.